The WHO is tracking, Canada is monitoring, doctors are studying what exactly might be causing this. But the line that stands out from Christine's report on that to me, 75% of the children tested positive for an adenovirus, which usually leads to common cold symptoms. What could be going on?
It's just unclear. It really is unclear. We know that there's over 169 cases of this worldwide. You see this in multiple countries. As Dr. McGeer said, it's obviously extraordinarily rare, but this is still a medical mystery. And I think it's extremely important that we don't have what we call an anchoring bias. We don't latch on to a particular diagnosis. Sure, of course, it might be infection related. It might be adenovirus related, but I think it's obviously premature to latch onto that. We still have to keep a very open mind in this investigation and consider not just infectious, but also non-infectious etiologies. The other thing too is, these are countries that have the capability of diagnosing a hepatitis type syndrome. There's probably more cases out there. There probably will be more countries reporting more cases. It's probably underreported in other places as well. And I think this is the type of thing that we'll learn more about in the weeks ahead. This is clearly attracting a lot of attention. Mm-hmm. The world's doctors and scientists are certainly devoting a ton of attention to this, and we'll probably have an answer in the days or weeks ahead.
You mentioned Dr. McGeer as part of Christine's report. She was unequivocal in her statement. There's no question about the fact that this is not related to COVID vaccines. How do we know that?
Many of the children who were impacted by this were too young to have a vaccine, so they just didn't have any exposure, yet they still had this particular syndrome. One of the other interesting things that I think has come up with this investigation is that maybe we're just detecting this, and maybe that there still is the suggestion that is this truly a signal among the noise? But it looks like it really is. I mean, usually it's not that difficult to find the underlying cause of an underlying inflammatory response in the liver. I mean, it's not an unusual syndrome, and there's a pretty regimented approach into working up the underlying cause of this syndrome with blood tests and other investigations, and even with liver biopsies in many severe cases. And we very frequently are able to come up with a diagnosis. So it's still a little bit peculiar that there's no smoking gun just yet, but I think with time and with pooled resources and sharing of information and a strong case definition and greater surveillance, I think we'll hear more about this soon.
Okay, just a couple more questions on this, because although rare, it's the kind of thing that parents obviously become very concerned about. So not linked to COVID vaccine, because the vast majority of the children were too young to receive a COVID vaccine. But Christine did indicate, and the numbers tell us, about 20% of the children had COVID. So what about possible links to COVID itself, Dr. Bogoch?
Sure. I mean, I wouldn't rule anything out. I really wouldn't. And I think we obviously need to keep an open mind. We also have to acknowledge that in many of the settings where this is being found, you also have a pretty high prevalence of COVID. So is this true, and unrelated? Some of these kids had COVID. Some of these kids have this hepatitis syndrome, but they're not related whatsoever. Maybe there is a relationship. It's just premature to really hone in on it. And I think obviously we need to keep an open mind. Same with the adenovirus. I mean, adenovirus is a pretty common infection, not just in childhood, but also in all age groups. It's not typical to cause a severe hepatitis type syndrome. But again, I think it would be premature to rule out adenovirus as well. And then Dr. Feld, who was on earlier, also suggested either toxin or combination of an infection with an environmental exposure. I mean, I think everything's on the table at this point. Everything's on the table, and this is where we're in the data gathering phase of an investigation. And I think with time, with more data, sadly with more cases that are inevitably going to pop up over the days and weeks ahead, I think we'll probably have some more firm conclusions and a better understanding of what's causing this. It's sad. It's sad. Obviously, it's sad, but it's also fascinating, right? Like, it's a true medical mystery.
Right. Yes, absolutely. And as experts work to solve it, what should parents be watching for? Symptoms and that type of thing, Dr. Bogoch?
Right. I mean, the first thing to remember, too, is that even with more and more cases popping up, this does appear to be extraordinarily rare. So I think that's the first key thing. And the second key point is when someone has a hepatitis or inflammation of the liver, oftentimes you can have pain in the abdomen. You can have pain sometimes specifically to the right upper quadrant of the abdomen. Sometimes the skin color might change to a more yellowish color, also known as jaundice. Sometimes there's some nausea or vomiting associated with this, diarrhea associated with this. But again, if anyone's concerned, a quick chat with your healthcare provider can really help do this. The investigations are very straightforward. To see if there's inflammation of the liver, a simple blood test can tell you right away.
Rare. Thankfully, most of the children recovered fully. You've helped us understand it better, and we'll be paying attention to it. Thanks, Dr. Bogoch, as always.
My pleasure.